So the same week, we're finding out that 20 million vaccine doses are going to be distributed here in the U.S. by the end of the year. We're buying 100 million more doses for next year. And we're hearing that new strains are popping up overseas right now. So a big question, will all these vaccines work on the new strains? Joining us now is Dr. Anita Gupta from the Johns Hopkins University of Medicine. Good to see you, doctor. So I want to put it slightly in a different way. Is there any reason to believe that all these new vaccines will not work against the new strain?
Hi, David. Thank you for having me. Right now, we have no indication that, the new variant, will really impact the current vaccination process. But certainly this is critical new information. The World Health Organization discussed this on Tuesday, that the new variant includes 14 key new mutations. And that new critical laboratory investigations are required. And in fact, Pfizer and Moderna are doing new investigations. New evidence is being looked at to determine if the vaccine is indeed going to protect us. So there is new research that is going to happen, and we do need that information right away.
Now, could this more rapidly developing variety or mutation of COVID be one of the reasons why we're seeing it spread so fast in places like California? Could it have popped all the way over to California?
Well, it's too early to say. It's too early to say. But we do know that, what is happening in Los Angeles County, one person, is dying every 10 minutes, according to officials there. And we certainly know that there has been new restrictions. Dozens of countries have banned travel from the UK in an effort to contain the new COVID variant that has been reported in England. So, it's really important to remember, the prevention strategies, staying home right now, to protect yourself and others, remember social distancing, masks, and to hand washing, most critically important right now. From our federal officials and even from the U.S. Surgeon General.
Doctor, I just have to ask, we're running out of time. I have to ask one more question. We've got all these varieties now, at least 4 that I can think of vaccines. Some of them are RNA vaccines, which deal with genetic material. The other are the old-fashioned, the adenovirus-based vaccines. Which would you advise taking quickly?
Most important to get a vaccine. Combined with the vaccine and comprehensive strategy, we're in a good place. They're over 90% effective, according to the evidence.
It's amazing that we have all these vaccines available so quickly. Dr. Gupta, thank you very much for being here. Appreciate it.